How increased screen time worsens susceptibility of mental health conditions. Mental health conditions include depression, internet game addiction, and anxiety. First, let's talk about depression. Depression is a common negative emotion in adolescence and is characterized by depressed mood, lack of interest and pleasure, lack of energy, and feelings of worthlessness. The onset of depression in adolescents and young adults is very common, and it can happen to those who spend much more time in front of a screen, specifically smartphones. There are several studies that support the evidence that depression is related to increased screen time. First, Kong's study reports that problematic smartphone use is a collection of games, social networks, and information-seeking addictions that lead to depression. In the study of Wang, they report that most adolescents with more than 2 hours a day of screen time, sedentary behavior, were more likely to be depressed. And lastly, McAllister's study, it was actually moderated by gender, and it revealed that when predicting depression, slopes for both girls and boys were significant. The differences in gender were studied. Girls who used screen time more than 2 hours a day were significantly more likely to have clinical significant symptoms of depression compared to those using less than 2 hours a day. With internet game addiction, Kanner's study defines internet addiction as having problems in social, academic, or business life due to excessive internet use. Video game addiction is the compulsive or uncontrolled use of video games in a way that causes problems in other areas of a person's life. In the study of Chen, it was found that 1 in 3 adolescents was addicted to the internet. The prevalence of excessive internet use is significant among early adolescents in the country of Taiwan, which conforms with the global trend. Given these points, longer internet use times were associated with internet addiction risk. And lastly, with the condition of anxiety, it's a very common disorder, especially those who are experiencing increased screen time. In the study of West, they report that approximately 8% of children and teenagers experience an anxiety disorder, with most people developing symptoms before the age of 21. Children with anxiety are more likely to have other issues over time associated with school, parenting stress, and unmet medical needs. Adolescents who are high screen time users were also twice as likely to have diagnosis of depression and anxiety, or needed treatment for mental or behavioral health conditions.